Well, good morning, everybody. I'd like to welcome you all here and thank you for coming out. My name is Jared Smith, and I'm the Western Region Peer Recovery Specialist for the Virginia Department of Corrections, and I'm a person in long-term recovery. Why we're here today is I've got some information, educational information about stigma, and kind of posing a question about, do words hurt? All right, now I'd like to go around the room and get everybody to introduce yourself. And we've got a check-in question, just who you are, and a check-in question of where were you born?
I'm Ashley Shreve in Richlands, Virginia.
James, Buchanan County, Virginia.
Jeff, Jewel Ridge, Virginia.
Christy McCormack in Richlands, Virginia.
Shelley Cole in Norton, Virginia.
Heather Tassel.
And again, good morning, welcome, and thank you all for coming. So, what is stigma? When you hear the word stigma, what comes to mind?
Judged.
Okay, judged, that's a good word. Anybody else?
Predetermined notions.
So what do you mean by predetermined notions?
Kind of like judged already before, based on either their speech or how they look.
So would that make it like an unfair assumption of how someone is or what they are, maybe?
Yes.
Stereotypes. Okay. So, what is stigma? So what exactly is stigma? Merriam-Webster Dictionary describes it as a set of negative and unfair beliefs that a society or a group of people have about something. And in recovery, we often see the effects of stigma firsthand. Sometimes it's through the language that someone uses to describe a person with a substance use disorder. It could also be the perception that someone has about people who use a certain substance. Stigma can be looked at as putting labels on people. And on this next slide, if somebody don't mind to help me out and read the first paragraph.
Stigmatizing language. How we talk about ourselves and others can sometimes have a bigger effect than we think. As someone who is living with a substance use disorder, have you ever been called a dope head, a needle junkie, a meth head, or even an addict? Have you ever referred to yourself this way or with any other similar words, or ever used these words to describe someone else?
Okay. And does somebody else mind reading the second one?
Have you ever referred to a positive drug screen as being dirty? Using this type of negative language can hinder the healing process. Just because we have used does not make us a dirty person. Our shoes may get dirty and our clothes may get dirty. Someone who is just trying to cope with life the best way possible should never be referred to as dirty.
All right, and now we're going to do a little exercise and talk about some stigmatizing words and phrases. Can I get a volunteer? Somebody with good handwriting?
And I don't spell good either, so don't make fun of me. Ashley, yes, beautiful Ashley, good job.
Don't judge me.
Look, I can read it.
You ever seen me write? You know it's impossible to judge.
So we heard dirty just a second ago. It's right, stigmatizing words on the top, please. And we've already heard the word dirty, as in used somebody's under drug scheme can be dirty. What would be some other stigmatizing words or phrases that you've heard in reference to people?
Tweaker.
Tweaker.
Different heads, meth head, crack head, dope head.
I've never heard it described as different heads before.
Well, I was reading old books from the 60s, and apparently people who use drugs used to just be called heads. And the meth head, the rest of it just came after, a little later.
No, it's not bad. Anything else? What about phrases like saying people will never somebody's never gonna recover.
Once an addict, always an addict.
Okay. What about stigmatizing language that's directed not toward people in, persons in substance use disorders but like toward law enforcement?
Pig.
Bacon,
What?
bacon.
Bacon, yeah. What about they're always out to get us?
Mhm.
They're not there to help. See, a lot of time when we talk about something like stigma, we talk about, at least in my mind, I'm thinking people with substance use disorders, they're calling them addicts, they're calling them junkies, they're calling them, tweakers, crackheads, whatever it may be, but you don't really think a lot about how it goes the other way, about stigmatizing beliefs that some people hold against others. Like I know, when I was in substance use disorder, I didn't think, I want to be caught dead in the probation office parking lot, unless I had to be there, or at the sheriff's office. So what are some ways we can replace stigmatizing language? Using person first language is a good way to do this, and here's a few examples of that. How about we take one term, one stigmatizing word and one destigmatizing word a piece, and if everybody help me out and read one.
Addict, person with a substance use disorder.
Clean, abstinent,
Dirty, actively using.
Dirty screen, tested positive for substances.
Clean screen, tested negative for substances.
Relapse, reoccurrence of substance use.
Smith, resume substance use, recurrence of substance use.
pregnant addict, pregnant woman with a substance use disorder.
Needle junkie, addict, person who uses by IV.
Drug, substance.
So could you see where replacing the stigmatizing word with the destigmatizing word could possibly be beneficial?
Mm-hmm. Yes.